Heart disease in general is the #1 killer across the country. And in particular, coronary disease and heart failure are the two major diseases that we can impact.
I was only 29 years old when I was brought to the emergency room. It actually took me a while before I realized what the severity of the disease was.
I was a little taken aback because nobody ever thought that I will have any heart condition because of my physical outlook.
Asthma, diabetes, heart disease. These are the most common and costly chronic conditions that millions of Americans face each day. In fact, they are so common that you probably remember seeing, hearing, or reading about them recently. You might even know someone who is affected by one of these conditions. But why is addressing these conditions important to you and your organization? The answer is simple: cost. Statistics on chronic diseases are alarming. They affect a significant percentage of the population, span a wide range of medical conditions, and account for a huge portion of national healthcare expenditures. In the United States alone, over 100 million people suffer from a chronic condition at a cost of over $600 billion. By 2050, the estimate will almost double to 170 million, with healthcare costs soaring over $1 trillion. At Kaiser Permanente, our goal is to provide safe, effective, and sensitive care to our members so that they can live healthier lifestyles, while at the same time keeping healthcare costs down. Our primary approach to this is through the development of a comprehensive disease management program designed to continuously keep our members on the right path to wellness. For example, patients are scheduled for and reminded about their appointments, offered support group counseling, and provided with both self and family education, which allows them to learn more about their condition while giving their loved ones the opportunity to learn about how they can help. We also support our members through our unique care management model. Our members become the hub of an active and coordinated care team, specializing in chronic care. Because they are all part of our unique integrated care system, our physicians and staff are able to provide unparalleled care, educating, equipping, and empowering our members to successfully manage their diseases.
I'd like to re-emphasize that heart disease is the #1 killer in our country. But it can be prevented in a large part by really modifying the risk factors. You can't change your family history, obviously, but we can help people stop smoking or have their blood pressure controlled or treat their diabetes or get their cholesterol under control. If we get the patients educated so that they are cognizant of these risk factors, that's a huge step. So education is very important. The second thing is to promote health in the workplace. And this might be something as simple as having educational brochures, having discussions at lunch, promoting healthier lifestyles with better food and dietary habits, and then also having the time or promotion of exercise.
Once I began to understand the complexity of the disease and how my body was reacting to the medications I was taking, the food I was eating, and whatever exercise I was doing, I realized that this disease was manageable. So the first thing I had to do was quit smoking, and I did that with nicotine patches. And I also watched what I ate better foods, ate more fiber, less cholesterol, and limited my salt.
Put another way, managing our members' care is like fitting puzzle pieces together. Our delivery of care is designed for our patients. We leverage our knowledge through our clinical practice guidelines. We provide patient and family education. We review our evidence by measuring the outcomes of our care, and we tie it all together through the use of our cutting-edge information systems, which help monitor and prompt our members' care.
Well, I think members are often surprised that they get a telephone call at home asking if they are taking a particular medication because one of our systems indicates that they might not be. They like that special interest. It's important to them, it's important to us.
Kaiser has done a lot for me. When I came here from the mainland, I already had this heart disease. And while I was up there, I was with a different HMO. Most of the time I felt like I was alone, like I was fighting this by myself. And I also felt like I was a bother to most of my doctors up there. But when I came over here, Kaiser gave me Kaiser surrounded me with a lot of good people. Besides all the technical stuff that they've done for me, some of the things I liked was when Dr.Kono, who's my cardiologist, would come into the room without my files, and we would just talk. He would ask me about my weight, if I was still riding my bike, and about any other complications that I might have had in my last visit. This made me feel like he was really listening to me.
At Kaiser Permanente, patient satisfaction is of utmost importance. That's why we've invested in and developed evidence-based guidelines and customer feedback tools, which helps us measure our progress. By listening to our members and redesigning the way we deliver care to best fit their needs, we remain committed to being held accountable for their care experience. And just how are we progressing? We now have a better understanding of our heart disease population through our electronic registry, a unique tool which ensures that our patients receive the right care at the right time. We also are able to monitor our outcomes of heart disease-related hospital visits to help us identify and share best practices. And perhaps the best indicator of all comes from our members themselves, who have consistently ranked us best among all the Kaiser Permanente regions nationwide in overall satisfaction.
As a specialist, patients often come to me after they've been identified as having severe heart disease. But if we can identify these patients earlier, that's gratifying because we could say, whoa, we were able to prevent this from happening. That's even more gratifying, I think.
We know that you can reverse the blockage of coronary arteries with the right type of diet, the right kind of control of cholesterol, using an aspirin a day, reducing stress, communicating more effectively, and having a modified exercise program.
If I was to judge, how I feel, just how I feel really good. I feel like it can go on. I feel like it can last a few more years, a lot more years in fact. It's been nothing but good since I came to Kaiser.
Kaiser Permanente, caring for Hawaii's people like family.